Hello, my dog lovers. Hi. I've been planning to record this video for some time, mainly because I felt I needed to organize my thoughts about one super important topic that many of you use in your life, in your dog's life, and that is how to decide what medical procedures to undergo, how to follow doctor's advice, and possibly how to go through surgery. And many of you know that recently I had undergone a surgery of my salivary gland. I had a benign lump, luckily benign lump on my salivary gland. And instead of being private about it, I decided to be very open about the whole process and how I made decisions. And today I'd like to give you a little bit of a summary of what the whole whole process was, and hope that it can help you to make the best decisions for your dog and yourself as well. Some of you may object that I am a veterinarian and I should not be poking my nose into human medicine. Well, I'm not necessarily suggesting treatments or anything like that. What I'm only saying is that when it comes to decision making in medicine, it's very much similar or the same when it comes to animals, our children, or ourselves. So just about a year and a half ago, felt my neck and realized that I had a little bit of a lump just below my ear. And initially I thought it was a lymph node, but also knowing that there are some other problems that may be in a differential diagnosis, I decided to see my GP. And my GP kind of dismissed me, saying that, it's nothing and maybe we should just do an ultrasound. And I wanted to, at that point, do a fine needle aspirate just to find out whether it's lymph node, something else. And that request was denied. So I went for an ultrasound. They told me that it was normal consistency and it's most likely lymph node. And I kind of felt, okay, maybe there is something else going on. I decided to check my teeth, and there was a little bit of an issue with my wisdom tooth, so I had it removed, which was not the best decision because it obviously didn't address the problem. So 3 months later, I went for a recheck to my GP, and we did an ultrasound again. This time I got a message about a week later, or my GP called me all alarmed that the lump has grown, and that I have to immediately go to an ear and throat specialist. Now, at this point, knowing that there may be some serious problems, lymphoma is one of the possible challenges, or some sort of other cancerous tumor, I kind of panicked and, tried to kind of keep it all together and decided to go to see a specialist. However, the waiting time was about 6 months at that time in Canada. So I kind of thought, okay, maybe I should be waiting, or maybe I should just go to the specialist office and see whether this is really not as urgent as my GP is saying, or the system is saying, not blaming this GP. And the specialist office actually told me, well, cases like this, we take right away. So that was another alarm. And I can understand how you all who have gone through some sort of similar situation feel, because when someone tells you that it's urgent, then you're thinking the worst. And so at this point, the learning for me was that it is important to acknowledge our emotions. It is important to do whatever we can to get the care that we require, obviously with respect and respect of others and so on, but not always take no for an answer, because sometimes it can be actually a very important step. And if we are waiting too long, things may be quite different a few months later. So when I saw the specialist, he took a sample. Luckily, the sample came back as a benign adenoma of salivary gland, which is, again, a very common growth of the salivary gland, and told me that he would schedule me for surgery, that the surgery would be scheduled probably within 6 months, but there's a waiting time or a waiting line. And I was fine with that, knowing that it should not cause any serious problems. The challenge that I had was that the surgeon told me that I will have an incision from my chin all the way to my ear, and that the facial nerve, which actually originates in the neck and goes to the face and controls my mimic and eye blinking and all that, may be threatened by the procedure, and that may be temporarily or indefinitely paralyzed. So that's something that kind of prompted me to look at some options. And again, the learning from this is if a surgeon tells you or any doctor tells you what the plan is, the next step is to actually go and really figure out and learn whether these are the only options. And because I'm not a human surgeon, I've done surgeries only on dogs and cats and other creatures. I went online and I basically checked research studies and procedures and protocols for salivary gland adenoma. At this point, I discovered that there is another procedure that is actually much less invasive and that includes incision or involves incision behind the ear down to my neck. And you can see my incision actually day 8 after surgery. It's barely visible, but it's still there. So that's what I had done. I know that many of you would probably think twice about talking to your surgeon and maybe upsetting them in case you would like to have a different technique or different method. But most surgeons are fine. They are busy, they have long waiting lines, and if you're honest with them, it's actually much better than if you're making things up or if you're trying to be kind and not communicate directly. Their communication is always good. So I went back to my surgeon and said, have you done this technique that I've learned about? And he said, well, I've done it twice, but only on smaller growths. And I realized that at that point, I have to be honest. I said, would you mind if I search for a second opinion and see what the options are? And he was very kind and very humble and genuine and said, no problem. Absolutely no problem. So because I am lucky and I am a citizen of 2 countries, the Czech Republic and Canada, I actually went to Europe and got an second opinion. The process was really interesting because while it was similar, it was also a little different. When I saw the Czech surgeon, I was taken in for another fine needle aspirate, and the surgeon spent maybe more than half an hour with me, which was a difference between the exam in Canada and in the Czech Republic. And I'm not necessarily saying that one is better than other than that it made me feel like I was really that the doctor actually was focusing on me and wasn't rushing to the next appointment. So that's the only thing. I'm not going to be naming doctors because I appreciate them both and very much value their opinion. However, as we go through life, we have to make some important decisions, and that's what I was doing. So after seeing the surgeon, he told me that it should not be a problem. I inquired about his interest in ear and throat surgery, and he said, I always wanted to be a surgeon, but I didn't like abdominal surgery because it was too crude. So I decided to go for ear and throat, and I like the detail of it. So I actually really enjoyed talking to him about it because I realized that he really loves what he's doing, number one. Number two, he was quite young, actually. The surgeon was 30 at the time he was, or is 30 right now. And, having a young surgeon can be very beneficial. And then there's a little bit of a concern. Maybe they're too young and don't have enough experience. But I felt really good about it. So decided to schedule a surgery and had to wait about 5 months for the surgery. And that happened just a week ago. So the whole preparation was a really interesting process. And again, whenever you're told that you have to go for surgery, just allow yourself to feel the emotions, because I'm not going to deny I was scared. I was scared about just what possibly could happen. Facial nerve paralysis. The growth could be something more than we thought it was and could be more dangerous or invasive. And the whole kind of cloud hanging above my head of the surgery was kind of tainting my everyday experience. But the other thing happened. I started being much more aware of how grateful I am for all the good things in my life and my partner and my family and PACS. And in that time of waiting, or during the waiting time, I discovered that maybe these experiences are really necessary for us to appreciate life and not whine about every single little thing that happens. Sometimes I imagine we're flying here on this amazing globe called planet Earth and flying through the universe in relative comfort, most of us. and we whine and bicker and bitch about everything. And it's really important to get a reality check about life. And this was definitely my reality check, even though I enjoy most parts of life and I try not to complain too much. And I'm very lucky to have meaningful work and have you. I still felt it was a good experience, even though it's kind of twisted to say that it was, but that's how I feel. The preparation for the surgery was also interesting. I saw GP here in Prague, and the time spent with me was more. The GP said, well, we reserved half an hour of time because people of your vintage usually require more time. But luckily, because I've been really trying to keep in shape and exercise and make sure that I'm prepared for the surgery, taking my supplements, taking my Fabulous 4 and omegas and mobility support and probiotics and vitamins and minerals, I felt really good before the surgery. And the only thing I was thinking now when I feel really good, now when I feel probably the best I've ever felt, I have to go for this procedure. So, mixed emotions. I made sure that my staff has all the different logistics figured out, and, my partner has the payment systems and everything just in case something happens and I would not be able to make decisions, which is unlikely because anesthesia is very safe, but still it's good to kind of look after things. So the interesting thing between the European system and the North American system is that they wanted me for the hospitalization a day before surgery just to settle in and so on. And because I have a sleepwalking disorder and I sleepwalk through glass door, I asked the doctor if I could actually check in and then go back home and come for the surgery in the morning. And they said yes. But when I asked whether I could go home the next day after the surgery, right after the surgery, the doctor said, it's either you're staying for 3 days or I'm not doing the surgery. So I knew that I didn't have a choice. And at the end, it was fine. I didn't have any episodes. So the whole process of checking in was really thorough. I had several doctors examining me, measuring my blood pressure and other things. Obviously, blood work and some other ECG and other tests were done before. And I checked in the hospital. And by the time I was in the hospital on Tuesday morning at 7 a.m., I was thinking, this is so surreal, but also so interesting and so important because I had never gone through surgery. And just looking at the whole preparation and also how organized the hospital was made me feel much better. The thing that I noticed was that the hospital that I had my surgery done, the building was about 30 years old. So it wasn't the newest, but the equipment was modern and new. And the thing that I noticed was that there were no supplies or laundry or carts in the halls that I'm used to from Canada. So it was quite orderly. The nurses were interesting, kind of part of the whole experience. It's so nice to observe. And so fun to observe because there was the pedantic but very kind nurse who would be giving instructions and would be kind of bossy. And then they were the nice nurses that were just smiling and so on. And then there was one crabby nurse that everyone was afraid of. And luckily she was there only for about 12 hours during my stay. But, so basically you lie down on the bed. They tell you to undress in the shirt and give you an injection of some sort of sedative and anticoagulant as well to prevent clots. We don't do that in canine surgery, but this is what they do. And then they bring you and they start carting you around the hospital and you see the lights kind of going and thinking, wow, this is pretty bizarre. You just kind of surrender yourself to someone else with your life and with your well-being and just trust that it's going to be all good. I realized also that I was able to kind of block my emotions a little bit. I don't really know when I learned this kind of skill. Or maybe during vet school when the exams were really hard, or maybe in my childhood because my parents were not always the most peaceful couple. And so I segmented, I shut down my emotions and just kind of watched myself being carted around. There's like a little conveyor belt that they put you on. It's heated and they just kind of move you from the bed to the surgical table. And again, a whole bunch of people kind of move around. And then the Next experience was really interesting because we were waiting for the surgeon and the anesthesiologist came and she started chatting with me. And it was so fun because she wanted to be a vet. And the reason why she became a human doctor was that she could not take her reptiles, her snakes, to the student housing in the town of Brno, which is the second largest town in the Czech Republic. So she stayed in Prague, where she lived, with her reptiles at home, and she studied medicine. So that was really fun. I was talking to her about the anatomy of snakes because I don't really remember much from the school, and I never worked with reptiles. And it was just so much fun to have this conversation. So it all went, really quickly. And I just kind of, enjoyed the conversation, weirdly enough, about snakes before my anesthesia. And then they gave me the IV and you just kind of try to stay awake a little bit and then you fade away like when you're falling asleep. I woke up pretty quickly after the surgery with the bandage on my face and felt really good, actually, surprisingly good, much better than I thought. So as the time progressed and I was just kind of sitting in the bed after the surgery, I was thinking maybe I should just go to a meeting that my team has in the afternoon. So weirdly enough, I just kind of got up and took my computer and sat in the patient room and did 1 hour of meeting with my team. And it was so much fun. Obviously, they were really surprised. And I was surprised, actually, that I was able to function so well. So then the next 2 days were no antibiotics, actually, no medication, no pain control, which was great. I had a little bit of a numbness around my ear, which is still there. But the doctor came back and told me that the nerve was intact, that it wasn't cut, but it was manipulated. So the sensation will take some time to come. But, having a numb ear and being able to smile is much better option. So I was really fine with it. Again, just kind of, being grateful for just being able to have this done and having this experience. The hospital stay was interesting as well because there were 2 other people in the room. Originally, I thought I would pay extra for a single room, but I actually was really happy that I didn't because I got to meet an 18-year-old rugby player who was with some sort of tonsillitis and had removed tonsil. And then there was an Egyptian guy who had some sort of swelling around his neck as well. So as we went through the few days of hospitalization, I became friends with them, and it was just so interesting. The rugby player, the 18-year-old, looked and behaved much more mature. And so we had some really interesting conversations. And I was thinking, could I have a conversation like that with an 18-year-old in another setting? It was just so interesting that he was so mature. I may not be the best patient because the next day I decided to come home for a dinner, and the nurses just kind of tell you, don't go outside of the hospital, you can go for a walk. But I basically decided to, because the hospital is only about 7 minutes from our place, I decided to come for dinner. My partner cooked me dinner and I had a salad. The hospital food was the only thing that I was really not happy about because it's bad. It's carbs and bad food and brown sauces and like any other hospital food. So I knew that having good nutrition was super important. And I don't really get it why hospitals and the medical establishment doesn't put more emphasis on good food, because if we don't eat good food, then we can really recover as well. A part of my recovery was the use of skin spray, and skin spray is a herbal formula that I use for wound healing. And when I got to the hospital, I kind of decided not to tell the staff that I'm going to be using this for my incision. I'm confident, and I was confident it's going to help and work and reduce my pain and discomfort and swelling and improve the healing. But I just didn't really expect them to understand because they don't know me. They don't know what I do. So I just kind of left it and was sneaking in the bathroom in the hospital and just spraying skin spray every 2-3 hours under the bandage. And the healing went super well. really didn't expect the incision to be as good as it is 8 days later. I'm not sure whether you see it. It's still a little tight. I have to massage it and so on, but it's done amazingly well. And I'm very grateful, not only for skin spray, but also my grandfather, who introduced me to herbal healing when I was a kid. He was a herbalist and collected herbs and sold them. And he taught me how to create these formulas. Other supplements, I took all my supplements, my Fabulous 4, my probiotics, my vitamins, my minerals, my omega oils, and also liver tune detox. And I would have a whole handful of capsules every day. But if you think about it, these are not tablets, these are not pills, they are nutrients, they're concentrated. And it's really nice to have an experience of post-surgical recovery that goes as well as it has. Initially, when I started sharing the experience of the healing and did a few social posts, I was thinking, I need to be really honest and frank how I feel and how scared I was and how challenged I was by this whole thing. And I kind of thought, I can't be, and I'm not this superhuman. Obviously, I have human situations happening. But as the healing kind of progressed, I was thinking, wow, this is really much better than expected. And I kind of was grateful, but I was also thinking like I have to tone it down a little bit because people will think that I'm just bragging about it. But I was as surprised as you may have been. So the day 3, I think I went for a little dinner with my niece to a restaurant, got a little release from the hospital for a few hours. And then I was let go on Friday morning. So believe it or not, on the day I was released, I went to the gym. And when my friends saw me at the gym, they said, "What are you doing here? You just had a surgery a couple of days ago or 3 days ago." I said, "I know, but I really want to go and stretch a little bit." So I stretched and I did infrared sauna just to kind of improve the blood circulation. And that went really well. And I also lasered my incision once a day since then. You may have seen the laser courses or have seen at least videos of Dr. Laurie McCauley, who is a board certified specialist who recommends laser use for your dog. So if you have not seen the course or have not seen the videos, just look up Dr. Laurie McCauley or laser on my website at peterdobias.com, and you will learn how you can use laser and what you can do to help your dog in injuries, in muscle pain, joint pain, sprains, and also scar healing. And since then, since Friday, what shall I say? I started going for walks with packs almost immediately. I have been going to the gym and gradually just kind of go back to my normal flow within pretty much 3 or 4 days. Today, I went for a swim the first time around just to kind of move my neck and release the tightness in that area a little bit, and massaged my scar and using skin spray as well and a little bit of a natural moisturizer just to keep it safe and soft. That's what I wanted to say. I'm sitting here today and thinking, wow, if I could transfer this experience into something positive and useful, it is to actually share it with you and make sure that every time you have something going on, make sure that you really are giving the right suggestion. Do research. We have AI these days. We have all sorts of different systems that actually can tell us what the options are for a particular treatment and how available they are. Talk to a couple of doctors. I always suggest and recommend to get a second opinion unless you're very confident that the suggestions you got is the right one. And let's stop bickering about silly things and politics and appreciate each other and appreciate our dog's health and our own health, and hopefully transform not only healthcare and how we approach health, but also nutrition and mainly how we look after our beloved dogs. I must say that if I could choose my dog Pax to go through this experience or myself, I would always choose me. And I believe and think that you feel the same way. But at the same time, if you need to go ahead and have a procedure done on your dog, please do not delay. Do not procrastinate, because it usually gets worse if we pretend that a problem doesn't exist. And that applies to your dog's teeth or your dog's lumps or, mobility issues, whatever it is. Just make sure that he make the best decision for your dog by learning, by asking questions, and then going ahead with the flow. It actually is much worse to anticipate the procedure and the problem or the whole process than going through it. That's my learning experience. Don't be afraid of life. Life happens. It can't always be just nice, pink and rosy. And with the challenges, we get to appreciate the good times and good health. And when disease strikes, you just have to go through it. And I know that not all of us are as lucky to have a benign lump removed. My brother and my brother-in-law passed away from a brain tumor. I know that many people have been diagnosed with serious problems and serious conditions. And I think that what we all care about is that when the proverbial shit hits the fan, that there are good friends and family and people that love us and who can stand by us. That's the most important part. So if you have anyone in your circle of friends who needs the support or who's going through a difficult time, make sure that you call them, make sure you text them, and make sure that you say that you love them. That's all for today. I hope you're well. Give your dog a hug for me, and I'll be back. Take care. Bye-bye.